I guess it's one past. So I guess we'll get going. Welcome everybody. Thank you for being here. This is the Health Literacy Solutions Center's webinar. It's about 2SLGBTQIA plus terminology. Our speaker is Elena Cyr. I will introduce her in just a minute. We are really happy to be covering this topic, and we're glad you're all here. My name is Julie McKinney. I moderate the health literacy discussion list, or the main health literacy community on the Solution Center site, and I'll be moderating today. And why don't we just get going and go through just some of the housekeeping. Just as you know, you'll all be muted during the webinar. Please introduce yourself or comment through the chat. That's there for you. If you have questions for Elena, they'll be answering them after the webinar, and I mean at the last 15 minutes. And if you can put questions in the Q&A, that will help us better keep track of them. So please do that. If you have any technical difficulties, there's the email here. I'll put it in the chat in case you need help with technical. The webinar will be recorded and posted in the Health Literacy Solutions Center webinar page. The PowerPoint, the slides will also be in there, so don't feel like you have to copy everything down. Those will be available for you by next week. If you're looking for CE credits, you must submit an evaluation. You'll get an email, and once you finish the evaluation and submit it, your CE certificate will be emailed to you. I think that is about it. I'll put all this information in the chat in just a minute. And yeah, and so if we can go to the next slide, we will get started. So Elena Cyr is a resource development specialist at University Health Network. They have a master's in health informatics and have been working in patient education at University Health Network for 14 years with a special interest in equity issues. They're currently a co-chair of UNH's 2SLGBTQIA plus committee. So we're really looking forward what they have to say. Welcome, Elena. We're happy to have you, and I will turn it over to you now.
Thanks, Julie. And thank you everyone for coming today. So as the outline for the webinar when you registered said, today we're going to talk a lot about the differences between sex, gender, orientation, what those concepts are. I'm hoping that by the end of this session, you'll have a better understanding of how gender, sex, pronouns relate to each other, and also a better idea of some of the current preferred terms that are used by members of the 2SLGBTQIA plus communities. So before we start, I just want to set some framing here in terms of what I will be speaking about. So first is that I'm white, I am a settler. My grandparents were born on the lands that are globally known as Canada, and I've lived in various areas of the province of Ontario for my whole life. So I will not be speaking about things like how gender or pronouns are used or conceptualized in other cultures, because I am definitely not qualified to speak to that, but know that where I'm coming from is very much a Western, white-centered perspective, and there's a lot more information out there, a lot more differences in different cultures. And so even within the 2S LGBTQIA plus communities, there's so much diversity, even within similar cultural groups. So there may be different preferred terms, different nuances in different cultural groups, even different locations within the same province, state, city, whatever. However, I've tried to do my due diligence here in terms of making sure that the information I share is as accurate as I can. I will definitely accept any responsibility for errors or misunderstandings where the information I share may not be totally representative of of, the communities at large. And on top of all that, just to say that gender, sex, and orientation are incredibly nuanced, or they can be very nuanced conversations, well beyond what we can cover in a 1-hour session. So please keep that in mind as we discuss. I'm really looking to share some of the basic understanding of terms, so sort of the textbook definitions of what the terms mean, but these terms can actually mean different things to different people, either as individuals or cultural groups, which may differ slightly or quite a bit from what the sort of textbook definition is. So the categories or labels we used are not very precise within the 2SLGBTQIA plus communities, but they do give a ballpark idea of what they mean and what they may mean to an individual. And just one last thing, language constantly evolves. So what we discuss today is not necessarily going to represent the preferred language in the future. And for participants, yes.
Sorry, can you just confirm what the 2S stands for? We had a question just before you keep going, just to clarify.
Yes, I will share more details about this later on, but it's for Two-Spirit. It's an Indigenous identity. But yes, I'll get into that a little bit more at the later in the presentation. So
thank you.
So also just want to acknowledge that we're all in very different places of learning. And, as long as we're learning, that's all we can ask for. Nobody's perfect. So, I want to acknowledge that some of the topics we talk about today may have you feeling discomfort, which is, nervous, awkward, anxious, out of your element. So that's a concept I've borrowed from Dr. Cheryl Ingram. So just to be very clear, that's discomfort is very different from feeling unsafe. Unsafe is when you are in a potential position to experience harm, pain, or loss. And that doesn't necessarily mean physical. It can also mean social, alienation from your community, emotional harm, those types of things. That's a real threat to your personhood, your ability to thrive. So I just want to make an acknowledgement here that, anyone who is an ally will not feel unsafe during this conversation today. I really hope, but you may feel discomfort. You may feel like there's a challenge to some of your beliefs or your opinions or reflections that you hadn't considered before. And I really would like, if you do experience discomfort, just reflect on those feelings at a time when it's safe to do so, and use those as an opportunity to learn and grow. So we'll start by looking at some of the general concepts related to sex, gender, and orientation. So first, what is sex? Again, this is lacking a lot of nuance, but in general, we think of sex as sort of a spectrum where male is on one end, female is on the other, where female is considered people who generally have the physical characteristics we associate with femaleness, like having a vagina, uterus, and vulva, whereas male are people who generally have the characteristics we associate with maleness, such as a penis and testicles, and then additional secondary sex characteristics. Sort of in between there, we have a whole range of people who would qualify as what's called intersex. And these are people who have physiology that is different or varies from what's classified as typically male or typically female. This is not a rare group. As many as 2% of the population are intersex, are born intersex, which is the same rate as natural redheads. So this is not a small group of people by any means. It's often hidden though. When someone is intersex, if it has something to do with their like their genitals, their ambiguous genitals, it's a very obvious or usually noticed fairly early on in their life. But there are also situations where someone going through puberty, experiencing fertility issues, that's when they may also discover that they have intersex characteristics that could be, missing missing ovaries, or sex chromosomes that are not what we typically associate with female or male. When we talk about sex as a concept, we're usually meaning one of two things. So that could either be sex assigned at birth. And again, this is what's based on the external physiology when the baby is born. And we often call that assigned female at birth, or female assigned male at birth, or male. But there is also this concept called legal sex, and really that is just what the government sees you as. They're not always the same. Sex assigned at birth and legal sex can be different, but legal sex is what you have on your government documents, such as your license, your passport, here in Canada, your health card. And it doesn't necessarily associate with your anatomy or physiology, because you could have been assigned female at birth, but maybe for some reason you don't have a uterus. We'll talk a little bit more about that a little later as well. So the next concept to talk about is gender. And when we talk about gender, there's kind of two aspects of it. There's the identity part, which is your internal sense of self. And this can fluctuate. So some people it changes over time. Some people it changes in different contexts. And a good way to think of gender identity changing in different contexts is to think about drag performers. So many people who are drag performers may consider themselves to be one gender when they're not in drag, and a different gender when they are in drag, whether or not the gender identity they feel matches the gender expression that they show to the world. Your gender identity is definitely not how other people perceive you. That's the gender expression side of things. It's not necessarily related to pronouns, and it is not a binary. It's not just men and women. And we'll talk about what that means a little bit more as we get into the more specifics. Gender expression is really just about how you show your gender to the world, how you present your gender to the world. So that often appears with things like your chosen name, the pronouns you use, not always, but can be the pronouns you use related to your gender expression, the types of clothes you wear, if you have a more masculine style, more feminine style, that kind of a thing, hairstyle, same idea, and the voice that you use, whether you use a higher pitch or lower pitch or what have you. So for a lot of people, their sex or sex assigned at birth or legal sex sort of so-called line up with their gender, so to speak. So that means, for example, if their sex is female, their gender identity is woman. But it's important that we don't mix up the two, particularly when we're in a healthcare setting. So there are many, many, many reasons why a woman, even if they were assigned female at birth, may not be able to get pregnant, may not have a uterus or ovaries, so we don't want to identify womanhood as, the ability to have a baby or the ability to get pregnant or having ovaries or uterus. Those are female characteristics. Similarly, a man who is assigned male at birth may not be able to get someone pregnant, may not have testicles, those kinds of things don't make a man. Those are characteristics of being male, typically. And then on top of that, we think about sex chromosomes, which are very much not something most people know what they have, right? It's an assumption that if you're female, you have XX chromosomes, but there are countless biological situations in which that's not the case. Somebody with XY chromosomes may appear, so to speak, female, may believe that they or may have the gender identity of being a woman. So, it's not as simple as a one-to-one relationship between the two. So, sex, when we're talking about sex, it's really about the physical body, your anatomy, your hormones, your genitals, your organs, the body parts you have. When we're talking about gender, it's about how you present yourself, or what you see yourself as in the social and cultural setting. So the roles you take, your social norms that you follow, the behaviors, the sense of self. So with that brief understanding of the difference between sex and gender, I want to encourage everyone to do this quick reflection. Without referring to your anatomy or your biology, so not talking about body parts or chromosomes or whatever, what does it mean to you to be the gender that you are? I'm not going to read any of this out loud, but if you're willing and comfortable, if you want to share some of your thoughts in the chat, it may help others reflect and feel through their own definition. And I'm not going to spend a ton of time with this reflection because we don't have a ton, but really encourage, if you don't have enough time to do it today, to think about this later on. Okay, I'm going to move to the next slide here. So pronouns. I mentioned earlier that pronouns can be a part of gender expression. For some people, it's so basically pronouns are the way that you want other people to refer to you if it's not using your name. So there's lots of different options. Common ones I think most people are aware of in the English language are she, he, they, but there's also these things called neopronouns that are such as ze, she, and even some people use the pronouns it. However, don't ever use the pronouns it for somebody unless they explicitly say that that's the pronouns that they use. As I said, your pronouns sometimes relate to your gender expression and gender identity, but not always. So just because somebody uses they, them pronouns doesn't necessarily mean that they view themselves as non-binary or another gender. They may still be a woman or a man, and just choose to use they, them pronouns instead. And then, yeah, similar to my example earlier about gender identity, the pronouns can change by context or by day. So again, thinking really, really simply, a drag performer may use she, her pronouns when they're in drag, and then he, him pronouns out of drag. So that's one way of thinking about how pronouns change by context. But it can also mean something like if someone's out in their personal life, but not professionally, or vice versa. Changing by day could be, some days, some people feel more feminine or masculine, and they want that to be sort of the way that they are viewed as the world, within the world. So they're not necessarily static. Most people they are, but for some people they do change day to day. And I want to talk about the concept of transition and transitioning, because I think it's a bit of a misunderstanding as well, that there are multiple ways in which somebody might transition. And really, these are ultimately changes that a person makes to affirm their gender identity when it doesn't match the gender they were assigned at birth. So some ways that people transition could be socially. So that's, again, largely related to their gender expression. So they may change their name, they may wear different clothing, they may change their pronouns or use pronouns that align with their gender identity, which could be different from their assigned sex at birth or assigned gender at birth. There's transitioning legally, which means changing your government documents. And then there is also a medical piece to this that some people do or do not do, which is gender affirming care. And so to transition, you do not have to do all three of these. People can pick and choose which of those make sense for them in their life. It's not a requirement that medical care, gender affirming care is required in order for somebody to transition. despite the fact that that seems to be the thing we focus on most when we talk about transitioning people who are in transition. And so just to say too a little bit more about gender affirming care, that it has this reputation, or it's being talked about right now as though it is a very much a transgender issue, but it is absolutely not. Gender affirming care is care that everyone can do. Lots of people do, even if they're not trans, even if their gender identity matches what they were assigned at birth. So gender affirming care are things that could be cosmetic, like hair transplants or laser hair removal. You think of women who get, their face laser hair removal of their eyebrows, facial hair, that kind of a thing, or arm hair, body hair, or men who get hair transplants all the time to cover up balding, to address their balding. There's also breast augmentation and gynecomastia surgery. So these are things cisgender people do all the time. Women get breast implants, men who have some fatty tissue in the breast area or their chest may want to get that removed because it messes with their perception of themselves and their gender identity. So these are things that everyone does. It's not just trans people. Medically speaking, there are also things like hormone replacement therapies and genital reconstruction that happen for cis people as well as trans people who opt into doing these things. I think about a lot of my experience has been within the cancer care realm, where hormone replacement therapies are very common for people who have breast cancer, people who have prostate cancer. Genital reconstruction is very common for people who have testicular cancer or gynecology cancers, So these are not things that are explicitly for trans people. These are things that everybody, gender affirming care is for everyone. And so I just want to take another 1-minute reflection. So too often we think of transgenderness as something from the cisgender lens, as in, what would it be like to be trans? But I want you to think about this for a minute as well. What would it feel like if society and all of the people around you insisted that you were a different gender? So not the one you were assigned at birth, but another gender. So if you were assigned to be a girl at birth, if your assigned gender was woman at birth, then what would it feel like if everyone around you insisted that you were a man? So again, take a few minutes to think about that and what that might feel like. So feel free again to share thoughts and feelings that this comes up in the chat, but again, I won't read these out loud. I will add that I shared this question in a previous talk with some of my colleagues, and a few queer people came forward and said that even though they're not trans, throughout their life, they have been misgendered regularly, and they could relate to this experience. So particularly a man who grew up and was very effeminate as a child was constantly being misgendered as a child, as a girl. So, it's not something that only trans people experience, but this really gets to the crux of what it's like to be trans and have the world insist that you're not the gender that you are. Okay, one last concept before we get into more details of the specific terms. So the first is, this is orientation. So orientation can refer to the genders that you're attracted to. Usually when we talk about orientation and attraction, we're talking about sexual attraction and romantic attraction. These can be different. So obviously sexual attraction is the people who get your heart racing, for lack of a better word. Whereas romantic are, more about, building intimacy, being close to, having that sort of romantic connection with. I want to stress, this is very important in healthcare, that someone's sexual or romantic attraction doesn't necessarily indicate their sexual behaviors, and vice versa. So I'm going to share a couple examples, and I encourage you to reflect on your reactions as I share these statements. So first, a straight woman who occasionally has group sex with people of all genders is still straight. Yes? Okay, next. A lesbian who's had sex with men in the past is still a lesbian. Right? I think we can all agree on that. A bisexual who has only ever had sex with men is still bisexual. An asexual person who has sex regularly with their partner is still asexual. And probably the most controversial statement, and again, this one, reflect on it if this does trigger something in you, trigger some thoughts or feelings, but a straight man who has sex with men is still straight. So again, we want to decouple this idea that attraction means certain sexual behaviors. There's so much variation when it comes to sexual behaviors that a label does not really, a label of attraction does not do anything, any way to describe what actually happens or what actual sexual behaviors the person does. So yes, just really encourage people to sit with that for some time if any of those statements brought something up for you. Okay, so now we'll get into some more terms and definition. We sort of already alluded to this earlier on, but at UHN, we use the acronym 2SLGBTQIA+. So why do we use this umbrella term? We use it as a way to reference all gender, sex, and orientation-based identities. And we use every letter because each one represents a different identity within our community. We know full well that this is a mouthful of an acronym, but in a world where our identities are being increasingly censored or hidden away, we feel it's very important to acknowledge and include the names of the identities within our community, rather than using more general terms, like sometimes you may hear sexual and gender minorities, sexual and gender diversity. It is very important in this day and age to say gay. Just say the words. It's totally okay to say gay. It's totally okay to say lesbian. It's totally okay to say trans. And hiding those labels away behind sexual and gender minorities hides us, censors us in a way. So I really want to encourage, even though it's a mouthful, it's important to recognize every letter in our communities. So what does the acronym stand for? Mentioned earlier, 2S is for Two-Spirit, which is an Indigenous identity. It's an umbrella term used by people across Turtle Island, or known globally as North America. L is for lesbian, G is for gay, B is for bi plus. We consider that to be an umbrella term, and that includes everyone who may be bisexual, pansexual, omnisexual, polysexual, biromantic, panromantic, omniromantic, polyromantic, and I will define those terms in a few minutes. T is for trans, which we also call an umbrella term. We consider an umbrella term, which can be transgender, transsexual, transmasc, transfemme, non-binary, agender, androgyny, and I'm not sure I'm pronounced that right, but bigender, pangender, gender fluid, gender queer, demi-boy, demi-girl, polygender, more and more and more. So again, I'll get into the definition of most of those common terms later on. Queer questioning is the Q. I is for intersex. A is, again, the umbrella term, two umbrella terms kind of, asexual, as an umbrella term for asexual, demisexual, gray sexual, aromantic, again, an umbrella term for aromantic, demi-romantic, gray romantic. We'll get to those definitions. And a plus just to add to acknowledge anyone who doesn't see their identities as represented within this acronym. We have evolved this label several times in the couple of years that I have been part of the committee. You know, it used to be just LGBT, but as we have learned to recognize more and more of the most oppressed people or most marginalized people within our communities, we are embracing that and encouraging, including the specific acknowledgement to them as we grow. So I'm hoping this sound will work, but I am not qualified to speak on what it means to be Two-Spirit, but we do have a recording, just audio, of a speaker named Anage Gizik, whose government name is EJ Quanabens. He presented a virtual talk for UHN back in June 2022 about Two-Spirit and clan identity. Anage Gizik is a member of the Loon clan. He's a Northern Woodland Anishinaabe of the Wabidagat or White Sand First Nations. And so it is a bit of a clip. It's about 3 minutes, I think. But I think it's very important that if the sound works, that we hear the sound from him. So let me see if this will work. If is the sound coming through?
No, no. Mario,
No?
is there anything that you can do on your end to make the sound work?
I do have a printout of what he said, just in case, because I was not sure if this would work. So I can also share the clip later on with some of the slides themselves. So I'm going to paraphrase some of what he says just to share quickly. So EJ shares that the term Two-Spirit was a term that was created around 1997 by two various different groups, one in Australia and one in Winnipeg, Manitoba. They're both at conferences, workshops, and there were sessions that were related to Indigenous HIV educators. So they sort of recognized that there was a common theme of not having a label for sort of what these people could be called. And you know, they didn't, you know, people were speaking about the same types of lived experiences, but didn't really have a name for it. So they came up with the term Two-Spirit, and it's meant to represent a person's ability to possess both male and female spiritual understandings. It's not meant to be a sexual understanding. It's very much a spiritual identity. And so there's a lot of misunderstanding often that if you're Aboriginal or Indigenous and you are Two-Spirit, that you're gay or queer in some way, you know, that's some sort of indication of your sexual orientation. But EJ is very clear to say that Two-Spirited has nothing to do with your sexual orientation. It's merely just a spiritual understanding of seeing both male and female sides of the spiritual realm. So yes, it's not fair to assume that anyone who is an Indigenous person under the LGBTQ umbrella is Two-Spirited. That's not the case. That's very inaccurate. And then on the flip side, it may apply sometimes to those people. But we also have to be careful that we don't generalize that anyone who is Indigenous or Inuit falls under the term Two-Spirit. And then EJ also goes on to just say that he wants to be very clear that Two-Spirit is very much an Indigenous identity. It is not meant for people outside of Indigenous communities to use as their identity. We already have our own term, our own terms. That's where the LGBT labels come in, not to take the Indigenous term for them, for themselves, and just to be very cautious about that. Yeah, so that's the gist of what EJ shared. And again, I'll share the full talk with everyone so that you can see more about what he says and hear him speak directly. Okay, so for the rest of the acronym, I want to get into some of the common prefixes here, because a lot of the gender identities and orientations use the same prefixes to sort of help explain what they mean. And so by knowing what the prefix means, you can kind of have a better sense of what a word or orientation or gender identity is intended to mean. So A as a prefix means without, so agender, without gender, without asexual, without romance, without sexual attraction. Sorry. Then we have gray, which is usually without. So in most cases, you know, no sexual attraction if you're gray sexual, but sometimes it does happen. Demisexual, demigender, or romantic depends on the situation. So there's very specific contexts or very specific situations in which someone will experience romantic or sexual attraction, for example. Bi typically means two, but I want to make the note that the term bisexual predates a lot of these other prefixes and a lot of the broader understanding we have of sexuality and gender. So when we say bisexual, it doesn't just mean attraction to men and women. It is historically been used as a third option next to homosexual and heterosexual. So bisexual was meant to be, you know, same and another. So attracted to your own sex and another sex or gender. It's not meant to just be so rigid to just man and woman. There's no transphobia inherent in identifying as bisexual. Pansexual means all or not limited by. So pansexual is, you know, attracted to all genders. Pangender is, you know, at some point being all genders or not being limited by gender. Poly means multiple, so it could be multiple, but not all. Omni means all as well. Cis means the same side. So what cis and trans means the opposite side. So really that's related to gender again, where, you know, your sex assigned at birth is a match to the gender you were assigned at birth, whereas to the gender that you live. Whereas with trans, it means that the sex you were assigned at birth has changed to something else, or your gender identity has changed to something else. Again, homo means the same side, hetero is the other side. So the last four are really rooted in scientific language, which if you've taken, you know, biology or organic chemistry, you know, some of these things will be very familiar. So when it comes to different types of genders, you know, traditionally we think of, you know, traditional thought is that gender is either man or woman, but we know there are so many genders that fall beyond the binary. And again, by textbook definition, a gender that falls outside of the binary falls under the transgender umbrella, but I want to caution that not everyone who identifies as one of these genders will consider themselves transgender or trans. And I also want to say that you know, these identities may be outside the gender binary because some people may find that part of their identity falls within the gender identity, the gender binary. So for example, if we have a bigender person and their two genders are man and woman, their identities still fall within the gender binary, but their identity itself may be considered trans and outside of the gender binary. A couple definitions here. I'm not going to go through the ones with the prefixes that we've already gone over, but non-binary and genderqueer, sometimes used interchangeably. I think non-binary is a more common term currently. But basically, they both are terms that are used for people who aren't a man or a woman. So, or people who are intentionally subverting societal gender roles. When we talk about gender fluid, that's a gender that changes based on context. So for example, they are a man in some situations, but not all situations. Drag performers, again, a great example of what gender fluidity could look like. I'm not saying that drag performers are gender fluid, but this is just an example to sort of understand that in different contexts, a drag performer may identify as a different gender. And also with gender fluid, it could be someone who changes their gender day to day, but I think more typically it's that somebody whose gender changes based on the context that they're in. And so when we talk about attraction, there's lots of different ways that we can break down the terms of attraction, but this chart really gets into it. So, attraction to one gender usually means straight, gay, or MLM, meaning men who love men, lesbian, or WLW, which is women loving women. Also sometimes sapphic is very common. More than one gender, again, we've got the sort of bi plus umbrella, which is bisexual, panromantic, omniromantic, polyromantic. And then the attraction to no genders, which is sort of that asexual, aromantic umbrella, which would be gray sexual and demisexual, demiromantic. I have a little asterisk beside demisexual, demiromantic, because these people may not consider themselves asexual or aromantic when you talk to them, but from a purely textbook definition, they technically fall under that sort of ace arrow umbrella. And before we get into some content for the next slides, we'll be getting into sort of how to be a better ally. Just wanted to focus on a couple key terms here that I'm sharing them for learning purposes, but I apologize. Some of these are considered slurs by members within their community, particularly if they're used by people outside of their community. So you've probably heard most of these words before, but generally speaking, it's best to avoid them if you can, and instead use the preferred language. So heterosexual, homosexual, we avoid that because it tends to put emphasis on sex acts. And like I said earlier, sexual behavior does not indicate somebody's orientation. So it's much better to use straight, gay, lesbian when speaking generally of a group. If someone self-identifies as heterosexual or homosexual, that's totally fine. But when you're speaking more broadly, please try to use the word straight, gay, lesbian. Same thing with transsexual. Again, strongly considered a slur by some people. But part of why we don't use that word anymore is because it kind of has these this implication behind it that it's somebody who has medically or physically transitioned. So their sex organs, sex, whatever, have changed in some way. And we know that you don't have to have any medical changes in order to be considered transgender. So trans is a better umbrella term. Transgender is also okay. Just again, unless someone specifically tells you they identify as transsexual, transgender is a much better term to use. FTM, MTF, female to male, male to female. A lot of the younger crowds using these terms, but again, they're loaded with assumptions about someone's identity and their transition. So it assumes that at some point that person considered themselves female and now they consider themselves male, or it could also imply that they were once female, they had a female body, and now they have a male body, which again is not necessarily the case. So again, trans man, trans woman are better terms to use in those situations. Preferred pronouns, again, avoid. They're not a preference. They are just someone's pronouns. That's it. And the H word, apologies for saying this out loud, hermaphrodite, again, is largely considered a slur by the intersex population because it implies that a person is both female and male. The idea of hermaphrodite is that they have both sex organs completely, and that is definitely not the case for intersex people. There's so much variation in terms of what intersex means and what that could look like that the H word is not an appropriate term to use to describe them. So I want to do this really quick. I know we need some time for questions, but I think it's important that we get into some of this being a better ally. So I'll do this as quickly as I can. So at UHN, we have a gender identity policy. Here are some of the things that policy outlines. I share this as a summary of some good key points and practices for allies. So ask patients to self-identify their sex, gender orientation. Only ask when it's required, when you need it for medical information, medical purposes. Always use the person's chosen name, their gender, and their pronouns. Using anything else is just completely disrespectful and really, really can harbor a lot of distrust. Provide services that align with the person's gender identity. So we think about women's programming, make sure that trans women are welcome in those spaces. Otherwise, you need to reframe what this space is. If it is just for people with specific body parts, make sure that that's clear and make sure that that's clear. And it doesn't really need to be. Is it really something that has to focus just on body parts? And then keep a person's gender, sex assigned at birth, their sex characteristics, sex orientation, and their medical history private. Again, common privacy practices, but sometimes we don't think about that when we're in a situation of providing care or working with other people. So these apply to patients, but they're also for similar things can be done for staff and colleagues. We also explicitly say that these following activities are considered abuse in care when providing patient care. So again, I'm reiterating this because I think it's important that we all understand that these things count as abuse. Repeatedly or purposefully using the wrong name, gender, or pronouns when speaking to or about somebody, providing less or lower quality of care, making unwelcome, humiliating, offensive, threatening, or degrading comments, and unnecessarily causing bodily harm, injury, or discomfort. So things like asking about someone's genitals when it's not relevant to their care, totally unwelcome, possibly even offensive or degrading, depending on how the question has come up. Not allowing a trans woman to use women's services, women's facilities would be providing less or lower quality of care. So yeah, just some things to think about. I think I have just 2 slides left. So really what we want to do here is to be a better ally, make being an ally a verb. And I say this to everyone, not just cis people, not just straight people. We all are allies to each other, even if you are part of the 2SLGBTQIA+ community, right? So how can you do this? How can you be a better ally? Read your workplace policies. If you don't have them, advocate for some. See if you can get them. I know it's a little easier here in Canada to have these policies because trans identities are protected under our human rights and our constitution and our laws. I don't know that that's the case. I'm pretty sure that's not the case in the States, but if you can read your workplace policies, get to know what they are, and advocate for improving them. As much as you can, avoid gender terms in your health information. If you're talking about a body part, talk about the body part. If you're talking about pap smears, as an example, people with a cervix, you don't need to say women. Not all women have cervixes. There, and some men have cervixes, and some people who are neither have a cervix. So making sure that you're really focusing on the language itself that describes the issue. And on top of that, the singular they is totally fine. So when you're writing about bring in your support person, have them be available to drive you home, that kind of an idea. He or she, don't use it. It's not plain language, it's not clear language to begin with, but on top of that, it's also unnecessarily gendered. You don't need to get into that. If you have a rainbow lanyard, if you have a pride flag, put them up, wear them all year round. Don't just put them up in June. We hear that all the time. June is a rainbow, or at least here in Canada with Pride Month, we see the rainbow flag everywhere. Make sure that you're wearing it all year round. Have pride symbols up everywhere all year round. Don't just put them up during your pride celebrations. Wear your pronoun pin. Practice offering yours if you're comfortable doing so. If you witness homophobia, transphobia, intersexphobia, or biphobia, send a clear stop message. You can just say something like, that wasn't very funny. We don't talk like that here. Or even just giving them a look, giving somebody a look that shows that you're not in support of what they're saying. That's really important. But don't let those things go unchecked. This is making me uncomfortable. Please don't use that language. Totally fine to say. And the last slide here. So what else can you do? So learn from 2SLGBTQIA+ about their experiences. So you can do that by reading blogs, listening to podcasts, following people on social media. There's so much information out there generated by people who have these experiences. There's no excuse not to learn from them. Affirm experiences of people when they say that they've experienced transphobia. Believe them. Listen to them. Practice using pronouns, the correct pronouns for people. If you're not sure about it, or if you're having trouble yourself, practice behind the scenes with a colleague. If you use a wrong name, pronoun, or gender, just offer a very brief apology, correct yourself, and continue. Don't make a big deal about it. It often draws unwanted attention to the person. You just need to acknowledge it, apologize, move on. And then finally, just reflect on the area that you work in. So what would this area look like if it was truly inclusive to trans, intersex, and queer people? And what would it take for that to happen? I apologize, I rushed through those last slides, but all of the information will be available on the IHA website later. So that's the end of my slides. I'll kick it back over to Julie.
Thank you so much, Elena. And we have a little time if you want a little bit more time to expand on that. We have one question, which is person writes in, I was raised to say thank you, mama and sir. What is a better alternative? Yeah, and there's probably other examples of gender-based, sort of polite terms that people were brought up using. So yeah, if you could speak to that.
Yeah. So I'm not going to have the only answer. I'm not going to have the best answer necessarily either, but a simple thank you would be one way, just not even including the gendered term. If you feel like you need to include an honorific of some sort, what can that look like? I mean, I know there's lots of jokes around of like using the term, gender neutral terms like my liege, but I know that might feel a little silly. So, that might not be the most helpful suggestion. It's perfectly okay to use that language if you know the person and you know their gender identity or it's a term that they're comfortable with. When it comes to strangers, I think, if you can just not use gendered language. So just say thank you. Just say, excuse me, trying to get someone's attention. Oh, you with the blue hat, say their first name if you know their name. You know, there's a lot of ideas out there, I know, but you know, it can be very hard to break out of things that you were taught and that become ingrained in culture as well. So, you know, friend, thank you, friend. Thank you, buddy. Thank you. Yeah, my friend, my neighbor. That's the comment that just came up in the chat. Um, you know, thanks, folks, when it's a group of people. You know, there are words out there. It just will take a little bit of relearning to get away from some of that gendered language. But again, like if you know the person, it's totally okay. Like you can call your mom, you know, you can call your grandmother, whatever. Like if that's what they use, like it's totally fair. But it's just really more when you're talking to strangers to try and think about how not to embed that gendered language when you don't really know.
I wonder also if, if you live in a community, I expect, I know in the South, there's a lot of ma'ams, or at least in the US and South. And I wonder if you're in that kind of a culture, if it's worth talking about it with your community, and sort of bringing up this same question with the people who are telling you, oh, always say sir and always say ma'am. So, just to sort of bring up that, there might be something different.
Yeah.
So we have another question. We produce patient education content shared through EHRs, electronic health records. We're stuck when trying to express the parent who is giving birth, for example, in prenatal care. So if we change to parent or birthing parent, it may confuse some readers. So we're now going with mother, but changing to parent in other circumstances where the reader wouldn't be confused. So we have some concerns about these limitations. So do you have thoughts on this, Elena?
Mm-hmm. Yeah, so what we've been doing at UHN is using both. So birthing parent or mother. I know it's clunky. It's the same thing, we also have started using breastfeeding or chest feeding instead of nursing or just breastfeeding. We know it's clunky, but we are opting more for inclusive language versus continuing to use language that we know excludes a segment of the population. So we've certainly heard too people be like, I'm not the birthing parent, I'm the mother, and that's fine. But for our materials, for our written materials, we want to be as inclusive as possible. So yeah, I think historically we've been using both in those situations, which isn't a great solution, I know, but again, we're leaning towards the equitable part versus the simpler language.
Yeah, and I know we've gotten some questions on the discussion list online about graphics also, and picture, if you have a pamphlet for prenatal care, showing a picture of, something different than a woman's body pregnant. So yeah, it's going to come up in a lot of materials and information that people provide. So thank you so much, Elena. This was really great, and I'm so glad that we had you on, and that you could explain some of this stuff. This is an ever-changing landscape, and it's always nice to keep learning and keep sharing what's new and how we should say things and address things. So we really appreciate it. And I appreciate all you for being here in the session. Thank you for coming. We have webinars every month. And like I said, the recording of this and Elena's slides will be available on our page. And yeah, and just please keep an eye on the Health Literacy Solutions Center for more information. And again, Elena, thank you so much for your talk today.
Thanks for having me.
Okay.